I'm excited to talk about Bexicaserin and really the opportunity, not just for your community, but included in developmental and epileptic encephalopathies is the SYNGAP1 community. So Lundbeck, really quickly, based in Copenhagen, our US presence is in Chicago. We have a legacy in neuro-rare conditions. Onfi is the trade name, or clobazam is one of the first medicines that was developed specifically for the treatment of seizures associated with Lennox-Gastaut syndrome. Bexicaserin works on a receptor called 5-HT2C. 5-HT is serotonin, or 5-hydroxytryptamine. There are 14 different types of serotonin receptors in the body, and one of them is 5-HT2C. The reason that we're so excited about this super selectivity for the 5-HT2C receptor is it's located on GABAergic interneurons. So, as many of you probably know, epilepsy is a result of an imbalance between excitation and inhibition. Either there's an overexcitation or there's a decrease in inhibition. When Bexicaserin binds to the 5-HT2C receptor, it results in increasing inhibition. And so, as you're thinking about this, all seizures are kind of based on this principle. So, in addition to working in conditions such as SYNGAP1, it also should be effective at controlling seizures in a number of different developmental and epileptic encephalopathies. I'm not going to get too much into the weeds here, just to say we've completed a phase 1b/2a study looking at patients across a diverse number or group of developmental and epileptic encephalopathies. And what we saw was we evaluated patients needed to have at least 4 countable motor seizures per 28 days. They needed to have developmental plateauing or regression. And then the reason for that developmental plateauing or regression and seizures was not specific. So it could be multiple syndromes, including LGS, Dravet syndrome, SCN2A, CDD, and SYNGAP1. So this study was specifically done in ages 12 to 65. We have data now for our trial that we're currently enrolling that goes down to 2 years of age. And again, the main thing that we were evaluating was, does it change the frequency of countable motor seizures? From a safety perspective, what we saw was, I think, really that bottom bullet point. The most frequent adverse event leading to discontinuation was somnolence, and so we've adopted a start low and go slow approach where we found that really patients get much better tolerability and that somnolence doesn't become as great a burden. Concomitant medications in that bottom right box, those are the types of medications that are typically treating seizures associated with developmental and epileptic encephalopathy. So what we see here is that there is a greater numeric reduction in countable motor seizures, almost 60% reduction in countable motor seizures in patients on Bexicaserin versus placebo, about a 17% reduction. And then this was actually talked about in one of the previous talks today, open label extension, whereas there were in the red dotted line, there were patients that originally were on placebo. In the open label extension, all patients are allowed to go on Bexicaserin, and what we see is there is a reduction in countable motor seizures comparable once they move to receiving Bexicaserin. So on the left-hand side for you, countable motor seizures was our primary endpoint, and then total seizures was one of the secondary endpoints. So I want to talk briefly about the studies that we're currently enrolling. We're going to focus on Deep Ocean, the one on the top, and that is for patients with developmental and epileptic encephalopathies, so regardless of etiology. And included in that would be patients with SYNGAP1 disorder diagnosis. We're looking, again, still at a reduction in countable motor seizures as our primary endpoint, 2 years of age and older, and we're in about 100 sites worldwide. Lastly, this potential therapy was deemed so important by regulatory authorities that we received a breakthrough therapy designation for seizures associated with DEEs in patients 2 and older from FDA. Again, I guess, or maybe not again, but I just want to clarify, that is not, that doesn't have anything to do with bringing the medication to market. It just allows us potentially for expedited review. So again, we're going to focus on the DEE other trial. So seizure onset must occur before 5 years of age. You can see one of the following countable motor seizure types that we're evaluating: developmental history of plateauing or regression, and then EEG markers that are indicative of developmental and epileptic encephalopathy. All patients need to be on a consistent, stable dose of at least 1 anti-seizure medication, and then could be up to 4 anti-seizure medications. And then despite being on those therapies, they have at least 4 countable motor seizures per 4-week period for a 12-week screening period prior to enrollment in the study. This study, unlike the one that I talked about 3 minutes ago, the Pacific trial, this will be a 1-to-1 ratio, patients receiving either their current anti-seizure medications and Bexicaserin, or their current anti-seizure medications and placebo. And again, this will be for about a 15-week period, after which the open label extension, anyone who would like to receive Bexicaserin would matriculate into that open label extension. I think I just addressed most of these things on the previous slide. The main, I guess maybe additional points: there are no echocardiograms required for our study, and this is due to the subtype selectivity 5-HT2C receptors. I think we will leave it there. This is just my way of basically saying 3 things. Number 1, hopefully coming soon to a city near you. This is also found on clinicaltrials.gov, so or you can talk to me afterwards, and we can make sure that there is what site makes the most sense for you and your family. The second thing I want to say is thank you to both patients and families, as well as investigators, for helping us conduct this clinical trial. And then the third thing is, even though we've got a number of clinical trial sites, either worldwide or within the United States, there is still some white space, right? And so I probably don't get, but I, in some ways, appreciate the burden that it is to try and travel. And just, again, if that feels like that is an insurmountable task, please just come and talk to us. We have services where up to 3 caregivers, so mom and nurse and sibling, or dad and aunt, whatever, can travel to these sites. And so I think the other thing that maybe is important to note is even if you live in Nevada, if you have family in Florida, if it makes more sense for you to travel to Florida, that's where we can make sure that you get routed. This is just kind of ways in which, so the deep studies at Lundbeck.com, clinicaltrials.gov, you can see the NCT numbers, National Clinical Trial numbers for Again, deep ocean would be that first one, which is more germane to the SYNGAP1 community. And with that, I thank you for your time.